Okay, you're ready to go.
Okay, I do the sonograms here at Metapark, and I was doing them at the Southeast branch, but we're training somebody to do them at the Southeast branch. I started here at CareNet in 1997 as a volunteer, and I was trained for the sonography in 1999. I'm actually a chiropractor. I knew about sonography before I started doing the obstetrical sonograms here, but I just did musculoskeletal stuff before. I really love doing the sonograms. When I first started doing it, I was doing it as a volunteer. Now I'm a staff member. The sonogram program was begun. We bought the machines, the first machines, in 1999. There were 3 people originally trained to do sonograms, and none of them worked out, so they ended up training me. When we first did the sonograms, we only did sonograms for girls who were abortion-minded or abortion-vulnerable. So the first year we did just 67 sonograms. And of those, 59 of them changed their minds. So we were very happy with that. And time went on, we did that for a couple of years, and then we found that many of the girls who said, who had positive pregnancy tests and said they were fine and everything was gonna be all right, they went home and family members or boyfriends or friends talked them into abortions. So then we decided that we would do sonograms on all of our positive pregnancy tests, unless they declined. We always ask them, but very few decline. So now we do about 450 here a year, or maybe even 500 a year. So we do a lot of sonograms now, and we have really good statistics. The last year we counted, I believe it was 2012, and we had 103 girls who were thinking about abortion, and we turned around 100 of them. So we were really happy. There's just something about seeing that baby waving at you, that makes it real and changes the woman's mind so often. When we do sonograms, when you have a positive pregnancy test, you're going to ask your client if they'd like a sonogram. And if they do want a sonogram, then you're going to get one of the staff members to set it up. We'd like to do it in about 11 or 12 weeks because we get good pictures. If the girl is abortion-minded or even abortion-vulnerable, we want you to notify the staff right away. And we will try to do the sonogram at that time if I'm here. I'm here on Mondays and Thursdays from 11 to 3, and on Tuesday evenings from 4 to 6. I'm just here tonight filling in for somebody. So if I'm not here, I'm actually pretty available. I have a very flexible schedule. I have a couple of other things that I do, but my schedule is very flexible. And so if you have an abortion-minded or abortion-vulnerable girl and I'm not here, one of the staff will call me, and if at all possible, I will be in here. Because even if it's very early in a pregnancy and we can't really give the girl a definitive date of the pregnancy or anything like that, I have a well-worn talk that I give them about the physical, the psychological, and the spiritual consequences of abortion. And if it's at all possible, I will be here. When the sonogram is scheduled, you will give the girl a reminder sheet. The staff member will have scheduled it. You'll give the girl a reminder sheet. That reminder sheet has to be read to the girl. It talks about the water requirement, and that we will phone her to remind her, that sort of thing. Because usually it's a month or 6 weeks down the line when the sonogram is going to occur. So just be sure that you emphasize to the girl that we need a real phone number, and about half of them, by the time we get around to calling them, generally their phone numbers are gone, their addresses have changed or something. But it does help if we have a real phone number, because months, 6 months down the line, a lot of them had forgotten about it or, couldn't remember the date. You are welcome to come into the sonogram room when we do the sonograms, unless the girl has some objection. We always have to ask the girl, but generally if you've established a relationship, it's a good thing to support them. When you come into the sonogram room, your job is just to be there sort of as a support person. You're not to be, commenting on the sonogram or anything like that. Issues can come up. One of our volunteers, longtime volunteer, the first time she came into the sonogram room with me, the couple, actually was a married couple, which is kind of unusual around here, and they were happy about the pregnancy, but it turned out that this pregnancy was an ectopic pregnancy. The baby was not inside the uterus. And so, the volunteer jumped up and said, "Oh, there's the baby," and there was no baby. And so I had to back things down and, encourage the couple to go to the emergency room, that sort of thing. And I said, "Okay, please don't comment on what you think you see on the sonogram machine, because that's my job." The next time she came into the sonogram room with me, the young girl was abortion-minded, and the girl, was on the table. I was doing the sonogram. She was talking to her. I wasn't really paying attention. I was doing my own job, and suddenly she said, "Well, then you're not a Christian," and the girl burst into tears, and I had to calm that situation down. I mean, the girl said that she believes in Christ, and maybe she wasn't walking the walk, but in my book, if you say you believe in Christ, then you are a Christian. And, we're not here to judge. And again, she was not supposed to say anything in the sonogram room. The girl disappeared. We were sure that she had an abortion, and, it probably had a lot to do with the way everything was handled. So, your job is not to judge or not to comment in the sonogram room. Usually we only do one sonogram. We try not to do them past 17 weeks because the board wishes us not to do that, and that's mainly has to do with liability, and the bigger the baby gets, the more likely you are to see a defect, and we don't want to see defects, and we don't want to tell them about it, to encourage abortion. And if the girl is abortion-minded, we will do more than one sonogram on her, especially if it's very early and we can't see the embryo inside the uterus. We'll encourage her to come back. We feel that every time we get a chance to talk to her about her situation, it helps. And you're welcome, as I said, even of the abortion-minded girls, to come into the room as long as the girl is okay with it. I teach a class called Dr. Dad, and that class is for young men who are, with their partners here during the childbirth class. We have childbirth class every month. It's 4 sessions. The childbirth class, the first session is a parenting class. It's mainly a video. Some questions can be asked. And the next 2 are actual, like a Lamaze class, breathing and what to expect in a child during birth, and what happens if you need a cesarean, that sort of thing. And the last class is a Bible study class. Well, the young men come too, and the first and the last class of the childbirth series, we take them out, and I give them what we call a Dr. Dad class. And in that class, we try to teach 2 different things. One is some basic infant care, and the other is we try to teach them how important it is for them to be involved in this child's life as a married father. And so, we encourage you, if you have male clients, or, when a young woman comes in and she's maybe going to have a pregnancy test, or even benevolence, is planning on taking childbirth classes, you encourage the men to participate and to be involved and to support her. And, you can tell them about the class and try to get them involved in that. So, okay. Any questions?
Yes. For the childbirth class, is that staff members, are you the only one who teaches that, or can?
I don't teach the childbirth class, I teach the Dr. Dad class.
Okay.
Somebody else is teaching the childbirth class to the women while I'm teaching the Dr.
Okay, and
Dad.
is that like a staff member or volunteer, or how does that work?
I believe that the ones that they're all certified childbirth educators, and I believe they're all nurses.
Okay.
But I don't think that that's, you can take a separate childbirth education class and teach in our classes.
And then volunteer to teach the class.
Yeah, and I'm not sure whether they're paid or not. I don't know the answer to that. But I think they're all nurses, at least, as far as I know, they're all nurses. Hi. Anything else? Any questions? Okay. Yes. I don't know how to turn this off.
I did it last night.